First, read is your briefing from Meet the Press and the NBC Political Unit on the day's most important political stories and why they matter. At 9:30 a.m. Eastern Time, Senate Republicans will unveil the draft of their highly anticipated healthcare legislation to their members, per NBC's Frank Thorp and Leigh Caldwell. But the Washington Post gets an early glimpse, and here's what the paper says is in the bill, with the important caveat that many of the details are still in flux. Like the House version that passed last month, the Senate bill will eliminate the current mandate that all Americans must have insurance. It will phase out Medicaid expansion. It repeals taxes on the wealthy. And it will eliminate funding for Planned Parenthood for 1 year. Yet the Post says there are also some notable differences. While the House legislation would peg federal insurance subsidies to age, the Senate bill would link them to income, as the Affordable Care Act does. The Senate proposal would cut off expanded Medicaid funding for states more gradually than the House bill, but would enact deeper long-term cuts to the healthcare program for low-income Americans. What about protections for pre-existing conditions? Senate Majority Leader Mitch McConnell has told Republican senators that he wants to maintain protections for people with pre-existing conditions under the law. But it was not clear to some lawmakers Wednesday what that would entail. To recap, the contours of the Senate bill that